They've been dubbed the Young Invincibles. They are the seemingly healthy 18 through 34-year-olds that oftentimes are not insured. And they're a major focus of the administration's Obamacare push. But they could be the ones hurt most by the president's health care plan. According to a study by the Manhattan Institute, Obamacare will increase insurance rates for young men by an average of 97 to 99%. Young women could see an increase of 55 to 62%. Penny Nance is the president and CEO of Concerned Women for America. She has just written an op-ed in the Christian Post on how Obamacare will affect young people. And she joins us now from our Washington bureau. Penny, will Obamacare really cost young people more?
Absolutely, Mark. We know that young people and young families are going to pay more than they originally bargained for. It's a bad deal. Concerned Women for America started a new program called #NotBuyingIt that particularly reaches out to young folks to educate them and equip them to talk about this issue. It's a bad deal for young people. It will increase their premiums and will not, at the end of the day, give them better health care. You know, we think there's a place for market-based reform where people still get to have individual freedom, choose health care that doesn't violate their own consciences on abortion and other issues, but yet still gets them the coverage they need. This is the wrong approach. The administration has bypassed the will of the people. 88% of people think they will have a worse deal with this form of health care, and they're right. So we are reaching out, educating them, and continuing to say we have got to repeal it. We certainly need to delay it 1 year.
Where is the money going? Now, in your op-ed, you mentioned the costs for youth offsetting the costs for others. Talk a little bit about that.
Well, unfortunately, instead of doing high-risk pools that allows people that are of higher risk to be pulled together with subsidies, perhaps, ways that we can actually insure those, we're lumping everyone together and doing a redistribution of wealth. We're actually stealing from one generation to pay for another one. Young folks will pay at least 3 times more than the average person, and it takes 20 young people to pay for the health care of one older person who has diabetes. It's not a good deal, and particularly young, healthy men are going to pay more. So that means that if you're a young person and you really just want a plan with $5,000 deductible that will cover you if you get hit by a car or get cancer, you're not going to be able to buy that. Instead, you have to buy a very much bigger plan that has all kinds of things in it that you don't want to pay for, maybe things that even violate your conscience, in order to pay for things for other people. It's really an issue of individual liberty, and there's also privacy concerns that young people should be worried about.
Okay, Penny Nance of Concerned Women for America.
You, Mark.
Thanks, Penny. Appreciate it.
God bless.
You too.